Alright, so in this video I'm looking at some guidances provided by the FDA, especially, well, only in the regards to compounding. So this first one I'm going through is prescription requirements under Section 503A of the Federal Food, Drug, and Cosmetic Act guidance. Something of note is that it does mention this guidance does not apply to drugs compounded for the use in animals, to biological products subject to licenses in a biologic license application, or to repackaged drugged products. So this is, strictly for compounding. And I'm just going to go through things that after I read it, I went through and highlighted. So sections 503A and 503B of the FD, Food, Drug, and Cosmetic Act address human drug compounding. Section 501A is concerning the current good manufacturing practice, CGMP. So that's what is 501A. So basically in section 503A, you are exempt from 501A, exempt from 502A, which is labeling of drug products with adequate directions for use, and 505 concerning the approval of drug products under the new drug application. So you don't have to approve these drug products. Section 503B, which was added, is for outsourcing facilities, and they are also excluded from 502, 505, and they're excluded from 582 concerning drug supply chain security requirements, but they're not excluded from section 501A. So if you are a 503B outsourcing facility, you do have to have current good manufacturing practice, CGMP. They are not exempt from this requirement. So some other notes: a physician may make an entry or order in a patient's health record that the physician compounded a drug in the office for administration to his or her patient. A pharmacist may compound a drug product before receipt of a prescription for an identified individual patient in anticipation of receiving such prescription. The pharmacist then provides the drug product to a patient or a prescriber upon receipt of the prescription. In the section risk associated with compounding drug products, so compounded drug products are not FDA approved, which means they have not undergone FDA pre-market review for safety, effectiveness, and quality. In addition, licensed pharmacists and licensed physicians who compound drug products in accordance with section 503A are not subject to the good manufacturing practice requirements. So there's a lot of repeating of the stuff in here, but these are definitely going to be asked in some form or way on the MPJE. So under the prescription requirements in section 503A of the Food and Drug Cosmetic Act, section 503B states that an outsourcing facility may or may not obtain prescriptions for identified individual patients, outsourcing facilities which are subject to the CGMP requirements. So they would still be subject to those requirements even for an individual patient's prescription, which is typically handled by a 503A facility. If it's at a 503B facility, they still have to practice the CGMP. Under compounding before receipt of a valid prescription order, a pharmacist or physician will compound a batch of drugs in anticipation of receiving another patient-specific prescription. This is also known as anticipatory compounding. So under the policy section of this document, to meet the prescription requirement, a prescription must identify the patient for whom the drug has been prescribed. If the identity of the patient is not given or is not clear, it will not satisfy this requirement. So an example is given: a prescription would not satisfy the requirement if it was written for the prescriber when the prescriber is not also the patient. Same under this, the compounder holds for distribution no more than 30-day supply of a particular compounded drug product. So this is in regards to anticipatory compounding. The compounder holds for distribution no more than 30-day supply. The amount of supply for a particular compounded product is based on the number of valid prescriptions that a compounder has received for identified individual patients in the 30-day period. So anticipatory compounding wise, you can't make more than the 30 days you expect, or that's just too much according to this guidance. And let's see, I have some other guidances to go through. The facility definition under section 503B of the Federal Food and Drug and Cosmetic Act's guidance. So in this one I highlighted a few things that you should know for the MPJE. So under section 503B, A compounded drug can only qualify for the exemptions from sections 502, 505, and 582 under the Food and Drug Act if all the facility's compounded drugs are compounded in accordance with section 503B. So, which further states drugs compounded at an outsourcing facility are not eligible for the exemptions provided in section 503A if the conditions in that section are met with respect to the particular drug. Alright, so under the policy of this document I'm checking out, which is a guidance, So under the supervision of faculty's management at the geographic location or address to be part of the facility, unless they are completely segregated from the facility by clearly identified boundaries. For the purpose of this interpretation, such boundaries may include permanent physical barriers such as walls or doors that are locked to effectively exclude other human drug compounding. So this basically says that separating a 503B and a 503A, it has to be very clearly defined. All compounding within the outsourcing facility is subject to regulation under section 503B and the good manufacturing requirements, current good manufacturing, CGMP. So under segregating compounding of drug products under section 503A from compounding drug products under section 503B, an entity that owns and manages an outsourcing facility may compound under section 503A in a separate establishment located outside the boundaries of the outsourcing facility. In determining whether a section 503A facility and an outsourcing facility are completely segregated, the outsourcing facility and section 503A establishment do not share any rooms. They both do not have any fixed equipment or supplies for use in compounding, so they don't share anything. The two facilities are completely separate. It doesn't mention employees, so it does imply that employees can work at both establishments, but the outsourcing facility and section 503 establishment have separate entrances and exits, do not share an internal pass-through opening, and are separated by permanent physical barriers. For example, it should not be necessary to go through the outsourcing facility to reach any part of the 503A establishment. So, furthermore, it's a compounder's responsibility to label, promote, and advertise its compounded drug products in a manner that does not mislead customers about whether the drug products were compounded in an outsourcing facility or a 503A establishment. The labeling should clearly identify the compounder who produced the drug product. And in the example, gives an instance in which compounding in an outsourcing facility is completely segregated from compounding under section 503B. So it says suites C and D are located within the same building, but each has separate entrances and exits, and they do not share any rooms in which compounding is conducted. In internal doorway or other pass-through, so a person cannot reach site D directly from site C, the two facilities do not share materials. So the facility's drugs products labels clearly identify the compounder who produced the drug product. So some footnotes here: each facility might have a separate entrance and exits within the same building or leading to the same hallway. So an exit could lead to the same hallway. And providing that a compounded drug is misbranded if it is labeling, advertising, or promotion is false or misleading in any particular. So not saying, clearly identifying whether it's 503 or 503B can be misbranding is what that's saying. So outsourcing facilities must label compounded drug products with the statement, "This is a compounded drug." Good manufacturing practice may require segregation of certain drug products or activities in certain circumstances. An example is that 21 CFR requires that operations relating to the manufacturing, processing, and packing of penicillins shall be performed in facilities separate from those used for other drug products for human use. So registering as an outsourcing facilities in the place of business, which is where the outsourcing facility's compounded drugs are manufactured, processed, packed, or held. If the outsourcing facility occupies only one portion of the building, its registration should include enough information to identify that portion. So the outsourcing facility can identify both suits B and C in a single registration. If the outsourcing facility occupies more than one building, its registration should identify each building. For example, if the outsourcing facility has a storage facility for the bulk drug substances and other supplies at 100 Main Street and prepares finished drugs at 101 Main Street, and then stores, repackages, and ships the finished drugs from 102, the outsourcing facility should register 100 through 102 Main Street as its place of business. And the final guidance I have is the Hospital and Health System Compounding under the Federal Food, Drug, and Cosmetics Acts. And here we have that the guidance describes how FDA intends to apply Sections 503A of the FTC Act to drugs compounded by licensed pharmacists or physicians in state licensed hospitals or health system pharmacies for use within the hospital or health system. So, there are not a lot of things to know from this guidance, but there was some that are important and could appear on your test. And I'll tell you them right now. So, the FDA recognizes that a hospital may need to maintain a supply of certain compounded drug products within the hospital, but outside of the pharmacy, like in an emergency department or an operating room, in anticipation of the patient presenting with a critical need for the drug, when there is no time for the hospital pharmacy to compound and provide the drug upon receipt of the prescription or order for that patient. And under policy, Section 503A does not distinguish between standalone pharmacies and pharmacies within hospitals and health systems. All right, thanks for listening. These guidances are beneficial. It really sinks in the information. So if you want to go through the FDA website and check them out for yourself, I approve of that. But I gave you a small overview of some of the things you'll find, and you may not need to do that if you're using. Of note, from that last one I read, forgot a whole little section, so I'm back to tell you this. Drug products compounded by a licensed pharmacist or licensed physician that are not compounded in accordance with all the provisions of Section 503A may be subject to regulatory action for violations of the new drug approval, adequate directions for use, and good manufacturing practices requirements of the FTC Act. An example, under Section 503A, licensed pharmacist or physician within the hospital or health systems must compound drug products for an individual identified individual patient. The compounding must either be A, after the receipt of a valid prescription in order for the identified individual patient, or B, in limited quantities in advance of receipt of the valid prescription in order for an identified individual patient, and the drug must be distributed after receipt of the prescription or order. However, FDA does not intend to take action if a hospital distributes compounded drug products without first receiving a patient-specific prescription or order, provided that 1. The drug products are distributed only to healthcare facilities that are owned and controlled by the same entity that owns and controls the hospital pharmacy, and that are located within 1 mile radius of the compounding pharmacy. So the main thing I'm talking about here is this 1 mile rule. You don't want to, if you're 503A in a hospital, you have a 1 mile radius in other hospitals located in your system. Over that, you can have to register as a 503B, from my understanding. So the drug products that are only administered within the healthcare facilities to patients within a healthcare facilities pursuant to a specific prescription or order. And 3, the drug products are compounded in accordance with all other provisions of Section 503A or any other applicable requirements in the FTC Act and FDA regulations. And just to clarify, the 1 mile radius in our policy is intended to distinguish a hospital campus from a larger health system. As explained in Section 11.b of the guidance, certain characteristics of a hospital pharmacy distinguish them from conventional manufacturers. However, a health system pharmacy that compounds drug products without patient-specific prescriptions for facilities within its health system across a broader geographic area could function as a large manufacturing operation, but without the necessary standards to assure drug quality. If such a pharmacy contaminates or otherwise adulterates or misbrands a compounded drug, the drug has the potential to harm many patients. Outsourcing facilities, which are subject to the good manufacturing practice requirements and other conditions that help to assure drug quality, can compound and distribute drug products to healthcare facilities nationwide without first receiving prescriptions for identified individual patients. I think that's a good paragraph. It helps you separate 503A and 503B and gives you knowledge about the hospital's 503A and 503B. And last thing, under hospital or health system compounding, under Section 503B of the FTC Act, a compounder can register as an outsourcing facility if it intends to provide compounded drugs to facilities such as other hospitals or clinics outside the 1 mile radius of the pharmacy in which the drug is compounded without first obtaining a prescription for the identified individual patient. All right. Good luck, and I'll post some more compounding and hazardous drug material soon.